The benefits of getting a flu vaccine are protection against the influenza virus that occurs year to year and is quite contagious. We see it in our workplace, our schools. It's something that gets spread very easy, so getting a flu vaccination will boost your immunity to that virus and ideally prevent you from acquiring that virus and spreading it to those around you. The protection that the flu vaccine provides is protection against the three most common strains of influenza that occur on a year-to-year basis, which is influenza A, influenza B, and the H1N1 strain, also known as the swine flu. The guidelines for who should get a flu shot is pretty much everyone over the age of 6 months. It's especially important for some people like pregnant women, our young children, the elderly, but pretty much everyone should get a flu shot, even if you're traditionally a healthy person. There are some people who should not get a flu shot. Those people are people who have had a severe reaction to the flu shot in the past, or who have a severe reaction to eggs, or if you have a temperature over 100 degrees, if you have a fever, it's best not to get a flu shot at that time. So the best time to get a flu shot is as soon as a flu vaccine becomes available. There's never too early of a time to get a flu shot. The reason for that is because year to year the flu season can occur at different times. Sometimes it's as early as October, sometimes as late as November or December. But it can take 2 weeks to get immunity to a flu shot, so the earlier you get the shot, the better. Yeah, the flu vaccine will protect you for about 6 months after you've received the flu vaccine. So it is important to get a new shot every year because the immunity you've received from last year's vaccine does not protect you on a year-to-year basis. There are a few options available for flu vaccinations this year. First is the old traditional flu shot. It is not a live virus, so you cannot get the flu from getting a flu shot. There's also a flu mist, which is a live weakened virus that you get in a nasal spray. And lastly, there is a new vaccine that you get with a tiny needle called a flu zone, and it just goes into the skin and not down into the muscle. So the flu mist is a live weakened flu virus that provides immunity for most healthy individuals. It is not recommended for children under the age of 2 or for people over the age of 50. It is also not recommended for people with chronic health conditions such as asthma or COPD. Some side effects of the flu vaccine may include low-grade fevers, chills, and body aches. Never too late to get a flu vaccination. The recommendation is that even if it's January or February and you're right in the middle of the flu season, still go ahead and get your flu shot because the flu season can last all the way till April or May. You can get the flu shot at your primary care doctor's office. You can also get it at urgent cares, pharmacies. A lot of employers will offer the flu vaccination, as well as some schools. I'm Dr. Matt Almaguer, and I work for Shawnee Mission Urgent Care.